A very good day to all the respected doctors, professors, members of the medical fraternity, and the students who have joined us here today from all over the globe. That too. It is in trying times like these that we truly get to witness the strength of our community on a global scale. That too. And aptly so, because the ailment that has got us all here today is of a global magnitude. Today, I will be shedding some light on the symptomatology of COVID-19. Now, before we begin, we must bear in mind that this COVID-19 is a viral disease, which makes it difficult to differentiate it from other viral diseases based on the clinical presentation alone. This has an incubation period ranging from 1 to 14 days and a median onset of 5.1 days. But the question is this really a deadly ailment? Now, we have seen that 80% of the people who are infected are asymptomatic, at least 20% to be symptomatic, and of this population, 90% will recover within the first week. Only 10% will progress beyond, and as the disease progresses further and further, the symptoms will get more severe, and 3% unfortunately succumb to the disease. But 3% might seem like a small number, but in fact, 3% going by our current population, 45.6 million lives lost. So this is not a joke. Now, this COVID-19 is a disease that spans multiple organ systems. So I will be discussing symptom clusters. Let's start with the respiratory system, which is the most commonly presenting cluster. This means in the upper respiratory tract, a sore throat, runny nose or congestion, and other flu-like symptoms. Then there is cough, which is initially dry but progresses to be productive. In the lower respiratory tract, this could result in the really dreaded symptom that we see, that is dyspnea, shortness of breath. A study from the UK also said that 71% of the people coming into the hospital either had or grew to be dyspneic. This is also associated with tachypnea. The next cluster we will be discussing is the musculoskeletal symptom cluster. Around 15 to 40% of the patients experience these symptoms: muscle or joint pain, fatigue, tremors, inability to speak. And this is due to weakness. Now, headache here merits some special attention because this could be the presenting symptom in around 6 to 10% of the patients. The characteristics of this headache would be usually it's a pressing or pulsating pain bilaterally in the temporoparietal, periorbital, and forehead regions. But again, there are around 300 causes for a headache, so it is difficult to say whether this headache is in fact due to COVID-19. Let's move on to the next cluster, that is the gastrointestinal symptoms. These include nausea, vomiting, diarrhea, abdominal pain, and discomfort. 3% of the patients present with GI symptoms alone, but it can also be associated with other symptom clusters. The next cluster would be the cardiovascular symptoms. Now imagine this. A patient comes into the hospital, difficulty breathing, chest pain, sweating, cold extremities. We might include in our differential diagnosis a pulmonary embolism or a myocardial infarction. But we have to bear in mind that patients of COVID-19 might present as an emergency with ACOV-CS, that is acute cardiovascular syndrome associated with COVID-19. And so we have to consider patients with obstructive and non-obstructive CAD as COVID-19 patients unless proven otherwise, even if there is no fever or cough. Talking about pulmonary embolism, this could be due to a dislodged thrombus that was already present, or this could be due to de novo coagulopathy. We are seeing coagulation occurring in COVID-19. And some studies have showed that clots can even be forming directly within the pulmonary circulation itself. Some patients could also present with leg pain and leg edema, lower limb pain and edema. These could indicate deep vein thrombosis. Again, this is also a coagulopathy caused due to COVID-19. The next cluster would be the neurological symptoms. These include delirium, confusion, agitation, altered consciousness, depression, anxiety, insomnia. Now, these could be due to the psychological stress of the disease, or they could be due to encephalopathy. Now we are seeing reports that the virus is entering the brain as well. There is headache, and the two most early symptoms of the disease, dysgeusia and anosmia. These could be due to the virus replicating within the posterior one third of the tongue's taste buds, and it could be due to the virus traveling along the olfactory nerves. I'm sure, talking about the delirious patients and confused patients, a lot of doctors, I'm sure, are seeing patients in their wards pulling out their IV lines, their catheters, just demanding to go back home. These are the kind of patients who are having neurological symptoms. The next cluster I will be covering is the dermatological symptoms. Although these are rare, they may occur. As you can see, I have put up some pictures of COVID toes, which is an itchy and painful rash on the acral areas. This is due to microthrombi in the circulation. Now, it could be the only symptom in the patient, or it might be a late complication as well. Other patients and cases have also exhibited ulcers over the buccal mucosa, papillosquamous eruptions, or petechial skin rashes. But we should always bear in mind the possibility of co-infections and other medical complications, and that not all rashes can be associated blindly with COVID-19. I have listed all these symptoms that I have mentioned, and I will be going over them quickly. New anosmia, new dysgeusia, headache, myalgia or arthralgia, sore throat, a runny or congested nose, cough, it could be dry or productive, dyspnea, tachypnea, chest pain, nausea, vomiting, diarrhea, abdominal pain or discomfort, fever, fever with chills or rigors. It could have chills or rigors or it could not. Lethargy, inability to move or speak, tremors, there could be a loss of appetite, generalized weakness, persistent hiccups, myocardial infarction or pulmonary embolism associated symptoms, deep vein thrombosis associated symptoms, erythematous rash, buccal ulcers, COVID toes, conjunctivitis, central cyanosis, and behavioral changes. Now, the patients could present with one, two, or more of these symptoms, or they could be asymptomatic even. As I have already discussed, 80% of the patients are asymptomatic. I would like to end with this quote: the only true wisdom is in knowing you know nothing. That defines the situation right now. And I thank you all for listening to me patiently. Have a good evening.